Sonu.
Thank you, Dr. Coker, and thank you, Scientific Committee, for having me a part of this program, unleashing the new VISUMAX 800. So I think we had a lot of discussions on ICLs, LASIKs, PRKs, ingrowths, and I think gone are those days. Why don't we talk of lenticules? And I think something which I really amazed, 400 eyes, 6 months, and this works amazing. So what is amazing about this is that it's right on target, it's faster, it's robotic, and it speaks. So how does this go? Let me see. So we all know the key steps in smile surgery. So first is this step. It takes around if you see 10 seconds. This is 2 seconds. So I'm creating the base of the lenticule, then I'm creating the side cut, then I'm doing a cap, and then a cap side cut. So 10 seconds, 2 seconds, 12 seconds, and almost around 3 seconds. So that is what compounds to 28 seconds when I'm talking on VISUMAX 500 or a creation of a lenticule on any other platform which is not on the Zeiss platform. So VISUMAX 800 different from 500 because the frequency from 500 goes up to almost 2 megahertz or a 2000 hertz system. Now what does this gives me? It gives me a very fast system. It reduces actually the laser time and creates a lenticule which is usually less than 10 seconds, a flap which is less than 5 seconds. And this, what does this shorter suction time actually translates? So it adds a peace of mind both for the surgeon and both for the patient. So it reduces the stress time for the patient, translates into lesser dry eye, lesser loss of the epithelial cells, and lesser suction loss. So what I want to emphasize is translation from 28 seconds to 8 seconds gives me that suction loss which cannot happen. 400 eyes in these 6 months, I didn't have a single patient for a suction loss. So the second most important is the energy transitions, which creates the tissue separation. The energy levels from 4.5 to 3 microns, the spot spacing, and the spot spacing for the side cut to 1.5 boils down to a very easy tissue separation. So just watch this here. Suction loss, we all know in the various multi-center studies, 50% of the times usually occurs in the first maybe 13 seconds. And this 30 second before the side cut, I think for most of the VISUMAX 500 users would see, whenever you have a suction loss, your face goes back on the charts, which says whether you can redock and restart the treatment, or you actually need to convert to a flap, or you take a new pack and start again. So 12 seconds means you didn't have a lenticule side cut and you actually cannot proceed to a lenticule and you convert to a flap. Now this is those situations where VISUMAX 800 outscores the 500 because the treatment time is 8 seconds. So 8 seconds means when most of the part is over. So this is what has really helped us in our initial 400 patients, not even a single patient that we had a suction loss, because the process is just a blink of the eye. The second important, with the reduction in the spot spacing, has actually translated into what we call as the ease of the lenticule separation. This beautiful paper from the RP Center, and Dr. Coker is a witness to this. I would really compliment him for the excellent work that they're doing on refractive platforms. So basically the paper speaks on that the difficult lenticule dissection and extraction is the most surgically challenging part of the smile surgery. Now, when you have a very smooth lenticule dissection, I don't think there is any chance of we having complications related to lenticule dissection and lenticule separation. One great feature with this equipment is the centration. Now, we all know that whenever you have a decentration more than 0.3, it basically boils down to induction of aberrations like coma and spherical aberrations, and that too, it is more magnified when you are dealing actually with more of astigmatism. So if you are just treating a plano, it could not be so much aggravated, but if you are treating a plano with a cylinder, you have a decentration, it actually leads to more of induction of these aberrations. So the center aligned system with this 800, it is what is very important. So you have your ILMaster 700, which is actually speaking to the VISUMAX 800 on a forum platform. So the patient data is captured on the Atlas, on the ILMaster 700, and then you take the patient on the VISUMAX 800. So the angle kappa, which the XY centration, which you have taken from the Atlas, would be directly taken on this system, and this actually takes care of this centration. So what I want you to actually look into is this. So this blue is less than 0.2 millimeter of decentration. Anything more than between 0.2 to 0.4 would be something yellow here, and anything beyond 0.4 would be a grossly decentered. So the target is just to center here so that there are no questions of angle kappa. So you're treating right on the visual axis. So that is what boils down to Vision 2020 day one. So I think this is one beautiful, innovative workplay that they have got. So just a quick video which I want to you to experience how fast this equipment and what is the ease of workflow with this VISUMAX 800. So the patient properly paint draped and BSS properly dried, and this is how you see the arms working. So this is the operating microscope, and it's again an amazing tool which has both the slit lamp adapters, and so this goes up, and this is the laser microscope which comes down. So you have here this is the joystick which works here, and once you rotate, this is the interface, this is the laser delivery system which comes down. So you need to put the disposable suction attachment here, and this is directly attached here where you have a magnetic attachment and it directly glows. So now this is the graphic interface display, and this is the centration that I'm talking about. Just watch carefully, there is a ring in the center, and you actually need to get this yellow inside the ring. So the moment it turns blue, that means you are right within 0.2 millimeters or less than 0.2 millimeters. 80% docking is the time when I apply the suction here. Just watch, it is just 8 seconds. So this is the lenticule, the side cut, the cap cut, and this is the cap side cut, and the time is 8 seconds. So by the time you start talking to the patient, the procedure is actually complete. So that's the beauty with the 2000 hertz system. And the second thing is the ease of dissection. Watch carefully. So this is, I open up the side cut here. I just go up, separate, go down, separate the base of the lenticule. And this is my dissector. I just go in straight. I'll just take a minute more, sir. I just go left, I go right, and that's the cap. I go underneath the lenticule, go left, put a small stump there, and go right there. Just watch the ease of dissection. There is no pressure that I'm exerting. Remove this, and this is what Dr. Gaurav Luthra, my dear friend, has taught us, the hydro expression, and the procedure is quite over. And this is what translates on day one, the slit lamp picture that I'll show you here. And that's the patient 2020 day one. There is hardly any evidence that you can see the patient has undergone any refractive surgery. So that's the beauty of this system that we have been experiencing for the last 6 months. A quick word for the third key feature with this equipment is the cyclotorsion alignment. And we all know that cyclotorsion, various studies have shown, could be somewhere between 3.3 to 4 degrees. And this actually takes care of cyclotorsion. Now, how does it take care? This would, once you have the access to the ILMaster 700, both the equipments would be talking. I want you to have a look here. I have marked the 0180 here on the slit lamp. Now I'm trying to dock the patient here. And once I've docked, this is the axis. So with the joystick, once the docking is done, I can rotate the joystick to the desired axis, maybe right or left, clockwise or anti-clockwise, bang on the target, so that it coincides with the 0180 degree marking, and you can achieve an excellent compensation of the cyclotorsion with this equipment. So all in all, a few of our results. What I wanted to emphasize is the reduction of the HOA. So initial 300 patients that we have done actually showed there was a significant decrease in the horizontal coma and the spherical aberrations. And this actually what translates you to 2020 day one. It's quite predictable, very safe. It's comfortable to the patient, and the quality of the vision is excellent. The workflow has been excellent, and it basically translates into less surgical and OPD man hours. So thank you so very much.
Thank you, Dr. Sonu. It was excellent talk, and in fact, probably the best machine available in the world in terms of the time and also the least complication. And even what I'm doing, see, the dissection is so easy. I could able to see. Even while doing the dissection itself, the lenticule may come along with the dissector. That smooth dissection you could able to see. Very good results. I think if they start, I think you'll have hypermetropic treatment in the coming days. I think even soon, I think Zeiss will also have a presbyopic treatment in this platform. It's going to be the great machine for most of the refractive surgery treatment.
So I think one platform for all refractive needs. Thank you very much.
Yeah.